Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanutu on Facebook and YouTube every Saturday at 4 p.m. on the online pregnancy school as she discusses pregnancy, delivery, and childcare with experts.
Welcome to the online pregnancy school, dear viewers. As I say, always it's a pleasure to come your way with this very educative program. This is your own program. Because, pregnancy should be a time of joy and not anxiety or sorrow. Unfortunately, sometimes pregnant women become so frightened, especially getting to the time of delivery, because a lot of things go on in their minds. They are not sure what will happen. And that is why we bring you the online pregnancy school to help you to understand issues that happen in pregnancy and how you can identify them and act promptly. Our goal is that pregnancy should be a time of joy and not anxiety or fear. My name is Dr. Linda Vanutu, and this is the online pregnancy school. We'll be right back. Issues that pregnant women can encounter during the time that they are pregnant. Some of them are known, others may not be so well known. And you know that I always bring you experts in the fields that we discuss. And today, it's a pleasure for me to introduce another colleague, a sister, a friend. Her name is Dr. Mrs. Rita Patricia Frimpong Amenyo. Doc, you are welcome.
Thank you very much, Dr. Vanutu, and I'm happy you have invited me here today.
Great. Today we're going to look at another side of pregnancy. I'm sure a lot of people may not have even thought about it, because when we mention that particular condition, people may not associate it with pregnancy, or that even a pregnant woman can suffer that particular disease. Dear viewers, we are going to talk about tuberculosis in pregnancy. And Dr. Mrs. Amenyo is the Deputy Program Manager for the National TB Program. So you realize that today we're going to go into detail about tuberculosis in general, and then we zoom into tuberculosis in the pregnant woman. So Doc, I've just introduced you as the Deputy Program Manager. Somebody might want to know, do we even have a program in Ghana that takes care of tuberculosis?
Thank you. So in Ghana, we have a program called the National TB Control Program. This program can be found in the Ghana Health Service. And because it is a national program, we have the program also in our regions and in our districts.
Okay.
So when you come to Ghana Health Service, we have the national level, we have the regional level, and the district level. So at the national level, where I work, we ensure that the nation is able to address tuberculosis in the country. So we lead the country to be able to address tuberculosis issues in Ghana.
Wow, it means that it's a very important program. Because for the whole nation to have an office to take care of TB, that means it's very important. But is TB an issue in Ghana that we should be concerned about and have a whole national program for TB?
Yes. Let me start by this. TB is among the leading causes of death from infectious illnesses. Yes. Usually when we talk about TB, we add HIV. Because TB, HIV, the #1 cause of death from all infectious illnesses. And in Ghana, we have the incidence of TB to be 148 per 100,000 population.
Now, what is an incidence?
Good. It is the number of new TB cases that we find each year.
Wow.
So in our country like Ghana, we are expected to find 44,000 cases of TB every year. That tells you how important the disease is. Because TB is an infectious illness. Yes. So you see, when you have about 44,000 people expected to be having the disease, and they are in our country, they are also transmitting it to other people. That tells you that it is a disease that is of great public health importance that we need to pay particular attention to.
Ladies and gentlemen, can you understand this? That in a country like ours, so many 44,000 new cases are expected to be identified within the public. And that tells you that it is key. So there's no doubt at all that the country should establish an office called the National TB Control Program Office to take care of TB for the country. That is great. So Doc, what are the goals of this office?
Thank you. So one of our goals is that we want to reduce the TB incidence from the 148 per 100,000 I spoke about to 111,000 per 100,000 population.
Okay.
And again, a lot of people do die from TB. And in 2018, if you take a population of 100,000, 52 people die from TB each year. So we want to reduce this mortality by about 35%. And there are people that when they get TB, because of the disease, they end up spending so much money. We know that TB affects people who naturally do not have a lot of money. We say it is a pro-poor disease. So for you to have TB and also spend about 25% of your monthly income on medical care, it means that the TB is causing a catastrophic cost to these people. So we want to bring this way down to zero. We don't want anybody to be burdened because of TB disease.
That is very important because a disease should not make you worse off. After all, if you have a condition that can be treated, then of course you shouldn't suffer unduly by spending 1/4 of your salary or the money that you gain on this particular. So that is the TB program, what it is set out to do, to ensure that people do not get the infection and those who get it have treatment and they do not die and they continue to live very well. That is good to know. But Doc, is it everybody who gets it? Can it happen to anybody, a man, a woman, a young child, an adolescent, anybody? Can anybody get TB?
Yes. Generally, everybody at all, whether you are a child, an adult, you can get TB. Because TB is by a droplet infection.
What is droplet infection?
It means that when somebody coughs or sneezes, sings, talks, and the person has TB, the person ends up releasing the organism that causes TB into the atmosphere. So when you also breathe in, then you also inhale the TB bacilli. And when you inhale it, then the bacilli settles in your lungs. But it is not everybody who inhales TB bacilli that comes down with TB disease. Okay? There are some people who have inhaled the bacilli, but they have what we call latent TB infection.
That means it is inside, but it's not showing.
Yes, it is not causing any disease. It is not causing any harm to the body. This is because their immune system is very strong, so it is able to fight the organism. However, there are some people who have the TB organism, and the organism is able to overcome the body's immune system. So these people end up getting what we call active TB disease.
Okay, Doc, before you go to that one, ladies and gentlemen, I'm sure you'll agree with me that this is very important. You know, these days, because of COVID, we are asked to wear the mask, which we are doing, not knowing that there's also that disease called tuberculosis, which is spread through sneezing, through coughing, through singing, through talking. It means that as you protect yourself, it's not just for the COVID, but you're also protecting yourself against other diseases. You know, she has told us that for some people, when they get it, the soldiers within them, that's the immune system, are strong, and therefore they're able to fight it. But there are others that cannot fight, and these people come down with the disease. Let's go for a short break.
Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanutu on Facebook and YouTube every Saturday at 4 p.m. on the online pregnancy school as she discusses pregnancy, delivery, and childcare with experts.
We are talking about tuberculosis in general, and then we'll go down to tuberculosis in the pregnant woman. This is the online pregnancy school. My name is Dr. Linda Vanutu, and my guest for today is Dr. Mrs. Rita Patricia Frimpong Amenyo. She's the Deputy Program Manager for the National Tuberculosis Control Program. That's the program set up within Ghana to address issues related to tuberculosis so that people do not get infected. Those who get infected get access to treatment and they do not die. And that is what we're talking about. Doc, moving on. So it means that TB is not what previously they used to call it, like the cough for the dead person. Yeah. It is not that one. So what are the symptoms?
When somebody gets the TB disease, the very first symptom the person notices is to have a cough. The cough, for some people, it will be a very light cough. And any cough that is more than 2 weeks of duration, that is associated with production of sputum or phlegms. A cough that is associated with a fever, that is body temperature going high, associated with chills, night sweats, feeling cold at some point, then you feel a bit of warmth, then you're feeling cold again, your body is shaking. That is what we say chills. And then night sweats. In the night, for an unknown reason, you are sweating profusely. Okay? And some people too, when they cough, they see some amount of blood in it. And others tend to lose a lot of weight. So these are the symptoms that people generally get when they have TB. But I must say that some people do get TB without having any of these classical signs that we are talking about.
Alright.
Because TB does not only affect the lungs, but it affects other parts of the body. It can affect the brain, it can affect the spinal cord, it can affect our bones, our joints, and as we'll be talking about pregnant women today, as a woman, TB can also affect your ovaries or affect your fallopian tubes. So you see that TB disease, although generally it is affecting the lungs, but there are some people that the disease affects other parts of the body. And we call these as extrapulmonary because they are outside of the lungs.
Oh, the pulmonary refers to their lungs. So these are extra, they are outside of the lungs. So if you are listening to us, please call a friend to join you. I'm sure doctor has told us so much. So it is not just about the chest, your brain, from head to toe. And if you're a woman and it affects your ovaries and the fallopian tubes and even the womb itself and other parts of your body, then you can imagine what will happen. It means that if you are not careful, you may not have a child. And because it is in that area, no, maybe because that part doesn't affect the coughing, it means people might even miss it, right?
Yes.
Oh.
So we are saying that when you are dealing with TB, as a doctor, as a nurse, you should have a high index of suspicion. It means that anybody at all who comes to you in the hospital, you should have at the back of your mind, apart from all the symptoms the person will present to you in the clinic, think TB. Because we are living with the disease.
Yeah.
And let me say one thing, because of the importance of this disease, that is why when every child is born in Ghana, not only in Ghana, in Africa and in other parts of the world, the baby is given an injection, we call it BCG. And we know how important this is to mothers. No mother will want to go home without the baby receiving this vaccine. Because once we give this baby this vaccine, it protects the baby against a severer form of the disease. So we are telling the baby's body, as you go out, there are some organisms there, but we are fortifying you. So when you go, you will be able to withstand it. That is the importance of the injection we give to babies when they are born.
Okay, then that means that it is good for pregnant women to go and deliver in the hospital. Because this immunization is given before, very, very early on after delivery, right? Before these babies are taken home. So it's very important that they go for the antenatal, they hear about this, know about this, and then have the babies vaccinated. Wow, that is great. Then it means that the NTP is doing a very good job. So what is it like? Those who have the TB, with the numbers that you mentioned, are we getting them to be tested so that we know that if it is 100 people we are looking for, we have the 100? How is it like?
Okay, so let me use the year that just passed as an example. The year 2019. We set out the beginning of the year having our vision to be able to get this estimated 44,000 people. At the end of the year, we got about 14,900 people, close to 15,000 people with the TB disease. There are some people who still do not want to come to hospitals to be tested when they are ill. Some of our relatives would want to go to other places, and for some people, when they see these signs and symptoms, they might attribute it to a spiritual cause, so they end up not coming to the facility. And for some who even come, it is not picked early. So they will go through hospitals, and as I said, the doctor or the nurse should have a higher index of suspicion. So if we do not suspect, we will not send this person to be tested for the disease. But the good thing is that in our nation, when you go to any hospital at the outpatient department, there is what we call the triage desk. At the triage desk, we have the TB symptom screening tool. So the nurse will ask you, do you have a cough?
And you shouldn't feel shy. You shouldn't hide it. If you have a cough, say I have a cough. Isn't it?
Yes. So the moment you respond yes, that you have a cough, then the nurse will ask you for how long, and we'll be asking you about fever, the symptoms we spoke about,
Yes.
nice weight loss, and ask you whether you have come into contact with somebody who has TB.
Yes.
So you see, if we go to the hospital, then a simple question like, do you have a cough? And we shy away from it. It means we are doing ourselves a big disservice.
Exactly.
Yes. So these are some of the things that have accounted for us not reaching out to the 44,000 people. And I must also say that there are some places in Ghana that the diagnostic tools are not available. However, getting to the latter part of the year 2019, the program saw this and came up with an intervention that when you go to any facility where they don't have what it takes to do a TB test for you, we have a courier service that will come to the facility. You, the patient, yours is to produce the sputum.
You don't have to pay.
No, it is free. So once you produce the sputum, the nurse at the OPD will package it nicely, and the courier man will come and pick the sputum, send it to a center where your sputum can be tested for TB. And the moment the results are out, it doesn't take long, within 2 to 3 days, you are called to come for your results. And even facilities where they have the TB diagnostic tools, that same day, people get their results. Wow. So you see, now we don't have any excuse as Ghanaians not reporting to health facilities if we have a cough.
Distinguished ladies and gentlemen, this is the online pregnancy school. My name is Dr. Linda Vanotu, a public health specialist. And we are talking about tuberculosis. We are going to talk about TB in the pregnant woman, but I think that it's very important for everybody to understand what TB looks like and how we can all help to identify cases so that they can be treated. We have just been told, if you go to a hospital, a health center, where they don't have the means of diagnosing it there, all you have to do, if you are coughing, tell them I'm coughing. They will give you a container to cough so that they take the sputum and you don't have to pay for it. The program has made provision to get this sample to a place and a courier will take it. You don't have to pay for it. All we want you to do is to be diagnosed and be treated so that you can live a good life. That is all. My guest for today is Dr. Mrs. Amenyo. She is the Deputy Program Manager for the National Tuberculosis Control Program, Ghana. And we are talking about tuberculosis. We'll be coming to the TB in the pregnant woman. But before we do that, we want to understand, Doc, what are some of the complications in the general public before we come to the pregnant woman? Because somebody might be a man and might have TB. What are some of the complications in TB?
Okay, thank you. So when you get TB, the primary site we spoke about is the lungs.
Yes.
So when you get TB, one of the major complications is that you have your lungs not able to function well. So you are having breathlessness, difficulty in breathing. And once it does that, the amount of oxygen that your body needs for you to breathe well, because the lungs is where the oxygen will pass, the body would have a lower level of oxygen.
Okay.
So you realize that you are weak, you are tired, and once this happens, remember, the lungs are helping in the blood flow, oxygen through the body. So now this is going to affect your kidneys, this is going to affect your lungs, and if the TB affected other parts of your body, especially in children, if it is to do with the brain, the children end up convulsing. So it's not every convulsion that you see that you say, oh, this one, it is normal in children, it will go. There may be an underlying cause. So that is one of the things. If you are a woman, that the TB too is affecting your ovaries, infertility is one of the painful complications that do come up when people get TB of the ovaries or the fallopian tubes. And then when people also get the TB and then they are not treated with what we call disseminated TB disease, then in the entire somebody, you see the organisms everywhere, and these people usually die at the end of the day.
Wow.
So the complications of TB start from where the disease started and how it is going to end. For some people too, because it is disseminated in their body, they end up losing blood. So they become very anemic. So the complications of TB, it's not that direct, because it is in the lungs. It is only you are becoming breathless. There are other things that also happen when someone gets TB.
And this is needless.
Yes.
You don't have to get to that stage. Dear viewers, you don't have to get to that stage. TB can be diagnosed and TB can be treated. You don't have to get to that stage. Please, you don't. Doc, now it is treatable, right?
Yes.
And the treatment, we have to pay for it.
The treatment is free.
It is free.
It is free. When somebody gets TB for
Wow.
6 months, that you are going to be on the TB treatment. If your TB is the drug susceptible one, if I say that, it means that, you see, when the organism enters somebody's system, the organism too is very clever. So it tends to change the body structure such that the usual drugs that we give out when somebody gets TB, the organism tends to evade how we want to treat it. So we say that one is a drug resistance. Yes. So it will dodge it. But thank God for knowledge. We have a way of addressing the multi-drug disease as well. So for a drug susceptible TB, for 6 months, you take your TB medication. It is free. And the treatment, it is not everyday hospital. We have community-based TB treatment. We have NGOs that are supporting us. Nurses in the hospital are ready to come to your homes. Relatives are also supporting their relatives who have TB.
That is very important.
Yes, so it is not only the nurse that will give you your TB disease, your TB medication. No, a relative who has been given some counseling who will be able to support you. So you don't have to worry at all.
Wow. It means that, you see, ladies and gentlemen, we are talking about tuberculosis. We are going to zoom in onto the pregnant woman, but I think it's very important that everybody understands, anybody at all who is close to you can have this disease, even yourself. But then there are structures put in place from national to the community level, to the home. They can even come to your home and support you with your treatment. All you have to do is to agree to take the tablets for your own sake and for the sake of your brother, your sister, or somebody who is around you. And that is what we are asking you to do. So we have heard that treatment is free. The lab test is free. All you have to do is to tell the hospital that I am coughing. They will check. If it is not TB, you will not be giving TB treatment. If it is, then you'll be giving the treatment. Doc, let's go for a short commercial break. Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanutu on Facebook and YouTube every Saturday at 4 p.m. on the online pregnancy school as she discusses pregnancy, delivery, and childcare with experts. Dear viewers, you are welcome. Again, you are listening to the online pregnancy school, and this is the program that tells you about pregnancy and how you will learn about pregnancy to stay healthy whilst the baby also stays healthy, and you deliver a very healthy baby and the mother also stays healthy. My name is Dr. Linda Vanotu, and my guest for today is Dr. Mrs. Amenyo. She's the Deputy Program Manager for the National TB Program, Ghana. Doc, now let's talk about the pregnant woman. Can pregnant women also get TB?
Yes. So when we talk about people who are at risk of getting TB disease, pregnant women are also part.
Hey.
And these people are people who are living with HIV, children are also at risk, people who live in confined areas, when you talk about people who are in prisons or in boarding homes, they are also at risk. When we talk about people who work in mining communities, yes, in Ghana that we have a lot of illegal mining because they don't have the protective wear, they are also at risk. People who smoke cigarettes, they are also at risk. People who take in a lot of alcohol, who consume alcohol hazardously, they are also at risk. So although everybody is at risk of getting TB, there are some population of people that are highly at risk of getting the TB disease, and pregnant women are one of them.
Are pregnant women. So what should they know? What should they do? If I'm pregnant, what should I do?
Okay, so when you are pregnant and you go for antenatal, as part of the routine questions that the midwife asks you, they always ask you, do you have a cough? And people take this question for granted. Anytime the midwife is going to the book and asking them, oh, no. But the cough is a very important question. Then she would ask you, have you come into contact with anybody who has TB? So for those of our pregnant women who didn't know what TB is, that is what we have spoken about. Anybody with a cough that had lost some weight and was going to hospital for some kind of treatment. So she would ask you, and these are the basic questions that she would ask. Of course, she will ask you about fever, she will ask you about chills. So at the antenatal clinic, these are the questions the midwife will ask you. And if you are a pregnant woman and you are also losing weight, we know that pregnancy naturally comes with some weight gain because of the physiological changes. But if you are losing weight, all the labs that they will do, they would also want to do a lab to test for tuberculosis.
And you should tell them, don't hide anything. You see, there's no point. There's no point in hiding a symptom that you have or a condition that is affecting you. When you have gone to the hospital, there is no point at all. So please, if you're a pregnant woman, we have talked about the antenatal. When you go to the antenatal, please, if you are coughing, even if the midwife doesn't ask you, tell the midwife that you have heard that a pregnant woman can also have TB. So please check it for me and let her do that. This is the online pregnancy school, and this program has been sponsored by Promise International, of which I'm the CEO. We have Vanotu International also supporting us, and then Reverse Tap. When you're having a party or a gathering and you have to serve your guests with drinks, use Reverse Tap. You see how it comes from the bottom. It is very hygienic. You don't touch the drink and the drink just fills up. Use that and you'll be happy. But as you do that, remember that they will be drinking more because of the fascination. So make sure you have enough. Now we are in a season of COVID and we are supposed to wash our hands and keep ourselves clean. Remember to use Bubble Gold liquid soap. This is the soap that will keep your hands clean. And please, when you are washing your hands, do it under running water. Don't put your hand into a bowl of water, but pour the water onto your hand and wash it for about 20 seconds, and your hands will be very clean. My guest for today is Dr. Mrs. Rita Patricia Frimpong Amenyo. She's the Deputy Program Manager for the National TB Control Program for Ghana. We have talked about TB in general. Now we are talking about TB in the pregnant woman. Doc, so this pregnant woman is at risk. Are her symptoms the same as with the general public?
Yes.
Okay.
In the pregnant woman, the symptoms are the same.
Okay.
And even in the pregnant woman, we say they are not specific symptoms because there are some of these little cough here and there a pregnant woman will get. So when the woman comes, the little things she says, the health worker should have a high index of suspicion.
So we are not just talking to the pregnant woman, but to the health worker as well.
Yes.
They should also have a very high sense of suspicion. Think TB. Okay, let's go.
So the pregnant woman's symptoms, the fever, the chills, the cough, they are all some of the symptoms that pregnant women do come with. But it is when the woman is showing the frank symptoms of consistent cough at every antenatal. This woman will come and she'll complain of cough. This woman will come and she'll complain of cough. We should sit up.
Okay.
We should not let her go without
Checking.
doing any test for TB.
Okay, so what are the complications in the pregnant woman?
In the pregnant woman, when the woman has TB, it starts with premature delivery. I mean preterm delivery. The woman is supposed to get to 40 weeks,
Yes.
but because of the tuberculosis, remember, if the woman is coughing, she will cough, increase in intrauterine pressure, and I mean all these account for what we get in preterm delivery.
Okay.
And then another thing is that she will give birth to a baby that has a very low birth weight. Studies have shown that pregnant women who had TB in pregnancy had children with low birth weight, and they were 3 times higher. Low birth weight baby can be found about 3 times in women who have TB compared to women who do not have TB. And again, because of that, when these babies are born, they don't survive.
Oh.
Some of these babies end up being born. Yes, the baby is born, and all of a sudden there's a respiratory distress. Yes, so these are some of the complications that will come. And of course, if the woman is not treated for TB, then it can lead to a maternal mortality.
Oh.
So when we speak about maternal mortality, it's not only the hemorrhages. TB too is hiding in the corner. So if we don't treat the pregnant woman when she has TB, the end result is obvious. So we actually need to pay particular attention to our pregnant women.
You know, all these are preventable. That is where I come in. All of these are preventable. If you go to the hospital and you tell them that I'm coughing, they will check. If it is TB, you'll be treated, and it is all free. It is free. Doc, now you have mentioned some of the complications in this pregnant woman. Now, what if the baby is born? It means that the baby will be too small for just the age. If the baby is even 40 weeks, the baby will not weigh as much as a baby whose mother does not have TB. And this child can also be born earlier than the 9 months.
Yes.
So both of them are disadvantage to the baby. So now, if this baby doesn't die and grows up a bit, are there also some complications that this child will go through?
This baby can also be infected with the TB disease. The thing is that as the mother gives birth to the baby, a very small percentage of the babies do get TB through the delivery process.
Okay.
Although this is not common, but it can happen.
Okay.
And for some of the babies too, because the mother has given birth and the mother is handling the baby and the mother is coughing on the baby also may get TB.
Okay.
So when this baby gets TB, then the problem starts. Now the baby has a low birth, if it has a low birth weight, this baby is not developing as it should.
Yes.
So you see that because of the TB, the baby has a delayed developmental milestone. So when the baby goes for weighing, the time the baby has to sit, the weight the baby has to get, all these are delayed. And that is the reason why at the child welfare clinic, our nurses who are there should take time and go through the mother's antenatal records.
That's very important.
And find out if this woman had TB, because it is going to affect the weight of the baby.
Exactly.
So upon all the nutritional counseling you would give, if the root cause is not identified, this baby will say failure to thrive. So
FTT.
yes. And that is a very critical point for us.
Okay.
So our nurses at the CWC clinic should pay particular attention. And as I also said, there are some convulsions that can also occur. We say TB meningitis. So if this baby gets TB meningitis, convulsion is going to come in.
And the brain.
Yes.
You don't want to deliver and have your baby having TB that will affect the brain. That will not let this child grow well. What about the bones for this baby? So you mentioned the spinal cord.
Yes.
Yes.
So as I said, TB can also affect other parts of the body. So when it affects the spinal cord, there are some people who have been bedridden because of TB. And it took quite some time for us to realize that this is TB. Because as I said, the presentation that they come with initially, it's not so clear. So it is when you are thinking TB that you get to know that yes, I should do a test for TB as well.
Dear viewers, this is the online pregnancy school. As I say, it's always a pleasure for me to come your way with the online pregnancy school, because we want pregnancy to be a time of joy and not of fear or anxiety. My name is Dr. Linda Vanutu, a public health specialist. And my guest for today is Dr. Rita Patricia Frimpong Amenyo, the Deputy Program Manager for the National TB Control Program. We are talking about TB, and now we are talking about TB in the pregnant woman, what it can do to the woman and what it can do to the baby, and even as the baby grows up into a child. This program is sponsored by Promise Ghana, Vanuatu International, Reverse Tap, Samzara Ventures, manufacturers of Bubble Gold liquid soap, and Erama Clinic. You know, in these days that we are in, it is very important that we become more concerned about our health, because there are so many diseases around us. So if you are looking for a place where you can go and have preventive health, then choose Erama. You can find them in Sakumono. And as you can see, their number is there and you can call them. You'll be happy you did. Doc, now we know that the woman can get it, the baby can also get it. We've told us some of the symptoms, some of the complications. But can this be treated? Can TB in the pregnant woman be treated?
Yes. TB in pregnant women can be treated as it is treated among the general public.
Okay.
So the medications that we give are such that we have a lot of research has gone on to make sure that when we give it to the pregnant woman, the baby is not affected. So it can be treated as well in pregnancy.
So they don't have to fear that I'm pregnant. If I go, they will give me this tablet and it may affect my baby.
There is no need for the fears and anxieties.
Wow. What about the babies when they are born? What is done for them?
Okay. So because the mother has TB, when the baby is born, the baby at a point is also tested for TB. And when the baby is tested for TB and the baby does not have TB, then we put the baby on what we call TB preventive therapy.
Okay.
Because we want to protect the baby from getting active TB disease.
Okay.
Because already the baby is exposed to a mother who has TB disease.
Okay.
So the baby is a contact. So we give the baby a TB preventive therapy. And the baby will take the medication also for 6 months. We have child-friendly formulations. So mothers should not be afraid of. And it is not only babies that we give TB preventive therapy to. Children below 15 years, if you are a contact, to somebody who has TB, your mother, your father, your cousin, in your closed environment. If you are in a boarding house and you have a dormitory mate who has TB, and even above the age of 15 years, we give you TB preventive therapy. If you are somebody who has HIV disease, we give you TB preventive therapy when we have tested you and made sure that you don't have TB disease.
Okay. But can the pregnant woman breastfeed her child?
Of course.
Okay.
The pregnant woman can breastfeed the child as long as the woman is on treatment. The woman can breastfeed the baby. There is no contraindication to that at all. So women should welcome their babies, breastfeed them for the maximum number of years we talk about, that is up to the 2 years, to make sure they have a healthy baby. And as they breastfeed, they should also take the TB medication, which is only for 6 months.
You see, these days, only 6 months. It used to be what? I don't want to have years.
Yes.
Oh,
there was a time that we were even people with multi-drug resistant TB. They were taking injections for 2 years.
2 years. Hey, so if you're like some people who don't like injections, then you are in trouble. But now they have combined some of these tablets, and you only have to take the treatment for 6 months. You don't have to fear. You don't have to fear. So this program is proudly sponsored by Promise Ghana, Vanuatu International, Reverse Tap, Samzara Ventures, manufacturers of Bubble Gold Liquid Soap, and Rama Clinic. My name is Dr. Linda Vanuatu, and today our topic was tuberculosis. And we spoke about TB in the general public and in the pregnant woman and her child. Doc, before we go, your final comments to the general public and then to the pregnant woman.
Okay.
And the husbands, what should they do?
Good. So to the general public, TB is an infectious disease. However, it is curable. The treatment is free and you can get tested for TB any health facility that you attend. Even if they don't have the equipment to test you, the health workers will ensure your sample is transported to a center where it can be tested. Then you have your results and the treatment. Treatment can be done at the community level as well as in the health facility. So TB treatment for somebody who has a drug-susceptible TB for 6 months, for somebody who has a multi-drug resistant TB for 9 to 11 months, it is free. You will not pay anything. So do report to a health facility when you have any of the TB symptoms that we have spoken about. To the pregnant woman, take your antenatal clinic very seriously. And when you go, be truthful to your midwife, whatever question she asks you. Because some of the symptoms of TB may not come labeled as TB. They may come as part of the usual symptoms you may be having. So please do take the questions very serious. And to our health workers, if a pregnant woman comes to you, please think TB. Of all the things you are thinking about, please do think TB. And let's ensure that we have a healthy population. Thank you.
What about the husbands?
If you are a husband, we need your support. If your wife is pregnant and she has been diagnosed of having TB, you are the first treatment supporter. We need you to support her psychologically, to also support her by being a treatment supporter, to be giving her the medication. The health workers will give you all the education that you need so that you would be able to support your wife in going through this 6 months of treatment. And because you are also a contact, because your wife has TB, please come to the hospital and we will test you for TB as well.
This is very interesting. Very, very, very interesting. That tuberculosis is preventable. It is treatable. You can live in a home with somebody who has, and you, the person staying there, can support this person. You know, sometimes when people have TB and they are working in an area, we didn't talk about the stigma so much, but I think it's a big issue, isn't it?
It is.
People are working in areas, once they are diagnosed with TB, then they are sacked from that place.
It is because of the myth that has been associated with TB for quite a long time.
Okay.
TB was considered as a disease that the moment you get, you die.
Yes.
So they say it's a disease of consumption. Because when you get it, then your entire system is being used up. So people are afraid. And some also ascribe it to spiritual illnesses.
Yes.
So when people get it, their families sometimes even shun away from them. But it shouldn't be so. The support a family gives contributes a greater part in helping the person who has TB to survive. Although the medications are there, if emotionally, if psychologically, the person is traumatized, it will not work. So we need the support of the immediate family, of co-workers, of the church in helping us in treating this menace that we call TB.
We couldn't have ended on a better note. This menace called TB. Dear viewers, this has been the online pregnancy school. As always, we bring you experts in the field that we discuss. Today you have learned a lot, I'm sure, that pregnant women can also have TB. But TB in pregnancy can be diagnosed, it can be treated, and the woman can get well. Her child can suffer if the woman does not adhere to treatment. When you go for the antenatal and you are coughing, please tell the midwife that I've been coughing. Tell her. If she checks and it is not TB, then you know that I have done myself good and I've done my child good. For the husbands, if your wife is pregnant and she's coughing, encourage her to have a test done. Tell her that when she goes to the hospital, she should let the midwives be aware that she's coughing. All of that is free. Treatment is free, the diagnosis is free. They can even come to your home to check on you, how you are doing, and you can always link up with the hospital. If there's no place at where you go for them to test, they will use a courier, and that tells you how important it is. It is preventable. And if you know that you have TB, also please, if you have stopped the treatment, remember that there's something they call the multi-drug resistant TB. That means that it's not just one drug that will not work, but multiple of them. All that is preventable. So please don't stop your treatment if you are on it, because this can be a menace. My name is Dr. Linda Vanotu, and this has been the Online Pregnancy School. My guest for today is Dr. Mrs. Rita Patricia Frimpong Amenyo, the Deputy Program Manager for the National TB Control Program for Ghana. This program was sponsored by Promise Ghana, Vanotu International, Reverse Tap, Sanzara Ventures, and Erama Clinic. See you again.
Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanutu on Facebook and YouTube every Saturday at 4 p.m. on the online pregnancy school as she discusses pregnancy, delivery, and childcare with experts.